name is Adil and I work for Stem Cell Care India. She is Miss Doris. She came from USA for her problem. So, may I know your good name, ma'am?
I'm called Doris Fonta and I live in Minnesota, USA. I came here yesterday with optic atrophy.
Okay. When it was diagnosed, ma'am?
1996, I was involved in a cyanide poisoning, and because of the poisoning, my doctor told me I can never see that that's all about my sight, that my optic nerves are broken, are bad, are destroyed. So that made me to look such ways. All I could do was to look for other treatments which I could not find. So I relied on God to do what I wanted to do in my eyes.
So, which line of treatment you have tried after that?
Whenever I go to check up, my doctor tell me your optic nerve is bad, and optic nerves cannot be grown again. So no remedy for me. And also I had this dilated eyes before. Whenever I go to hospital, they don't need to dilate my eyes. They will change my eyes. So last time I went to the hospital for my eyes, which is just December of last year, that's the first time the doctor gave me a drop in my eyes. I was pilocarpine 1.25% to close the gap between the opening and to see where they can, by closing it, but they're dilating my eyes. He said he thinks if the dilating is closed, I'm able to see, but it didn't help.
So, what is your present condition in 2022?
Well, in January, I heard of this stem cell. No, I didn't hear of it in January. Before, like 7 years ago, I heard about stem cell. I went to my doctor as a patient can go and ask him what they can do about my side so I can do stem cell. He told me, Doris, this is an illusion, nothing exists as stem cell. And I'm surprised, this is January. No, last 2 years ago, my sister went to Mexico for alternative treatment. She had cancer, and she heard of stem cell there, but the way she was treated with cancer, she didn't like me to go back there. So I didn't pursue her until my nephew came to India, Bombay, for his own stem cell, and he has, I think, cerebral palsy. They call it, and he's doing well. So when the mom came in follow up, I asked her to check out where they can do optic atrophy here and see. She did, and this is me here.
Okay, so how was your experience during the communication with our doctor and with our colleague?
Initially, I didn't know what to expect. So I don't know, I talked to when the person wrote me on the email, the person said they gave a phone number that I can also call for inquiry. I like to by voice to voice. That makes me more credible. So when I called him that night, he told me that indeed they can help me if I send to them my medical report. I'm not a hospital, I don't like going to the hospital or anything, so I didn't have much medical report, so I went up, I did what I could, and most of it I explained it by myself. And that's how I was given a try. From then onwards, I've been communicating on and back, and the communication pattern is so smooth. It is so smooth. It's not like difficult at all. No, you write the reply to you, whatever I want to give to you. That's it.
So, are you happy with the treatment part?
Yes, I'm happy with the treatment part. I'm just looking forward to having my sight.
Okay.
I want to have my sight. Boy, if you have me to contact, because I'll purchase to anywhere.
So, do you want to recommend any person for our center, Stem Cell Care India, for the treatment?
From my interview with Dr. Amos, he says it's the cells, their life for 90 days, I think so, and that before then I might have seen my, I've got my sight. If I have my sight, just the fact that I have my sight, it is not enough for people to come in. And I will recommend anybody who wants to have this to come in. It's not that expensive, it is just alright. If I can do anybody can also do it.
Okay, thank you.
You're welcome.